Hi, I'm Catherine Rasmussen. This is my presentation on Beautiful Boy for addiction counseling. Um, so, description of the movie was Beautiful Boy, with the main characters being Nick and David Sheff, who were father and son. Um, I watched it with just me and my wife. Our reactions were kind of shock and sadness at some of the things that Nick did, like stealing from his younger brother. And then, of course, the times that he cursed out his dad and left, stormed out. Um, Times that he was just outright lying to him. But our reaction, just as a parent, was really sad because you could see that David really cared and he really wanted to save his son. And imagining that for our own daughter was hard, but also from Nick's perspective, he very clearly felt that he was disappointing his dad, and that was really hard for him. And so that was really sad. So just a small clip. I really like that scene because I just feel like it's a really raw conversation, and it's probably one that many addicts have had with their own parents, and they're feeling really guilty, and their parents are feeling really disappointed. And I'm sure it's probably one of the hardest conversations they have because it's just that's clearly that moment where David realized that his son was falling into this addiction that he saw was hurting him. And so that particular scene shows just how fully, completely addiction can affect an entire family, and I thought that was a really important scene. So the rationale for selecting this movie, I watched several of them, and I really chose this one because it was such a detailed view of both before and after addiction. Um, and then of course it shows Nick's addiction over time. You get to see him, just at the beginning with that conversation with his dad, and then you get to see him deep in when he's running away in the car and breaking into the house and, stuff like that. And then you also get to see him recover and relapse and recover and relapse. And I thought that was a really important way to see addiction, to understand it better. I liked that Nick articulated his thought process on why he was taking them and why he likes them. Um, I just thought that that was also important to understand him better. And it shows Nick's family's experience in a realistic way. They didn't, lean into any stereotypes that you see in a lot of movies where, they're the traumatic, kid grows up with a traumatic family. This is just a very normal family that's very supportive and they love each other. And, Nick has a good relationship with his parents on both sides. And he he falls into addiction anyway, and I think that it's important to understand their experience in a really realistic way because it can really happen to any family. And then of course the realistic conversations like the one I just showed. Um, and I liked this one because it showed the medical disease model really well. You can see it very clearly in Nick, that it's kind of a almost like a physical need for him. He didn't take it because of trauma. He didn't take it because of stress necessarily. He started taking it just kind of because it felt good. He tried it and liked it, and he liked pot, and then moved on to the next thing, and the next thing, and the next thing, and um, I think the way he articulates it is that he just liked it, and so I think that's an interesting intro into the disease model. And then the other movies I watched, I didn't choose them mainly because I thought most of them focused more on the family's perspective and on the recovery process, and it didn't give you so much of the whole picture. And I really liked this movie because it gave you the whole picture. So Nicholas Sheff, he's the main character here. He's the one that is dealing with addiction. His medical history is that he began drinking at age 11. He entered his first rehab at age 19. Um, he has had 10 years of active addiction. His current addiction is crystal meth and heroin. He prefers IV injections. Um, he also uses cocaine, LSD, pot, alcohol, and ecstasy. He's had 6 inpatient and 4 outpatient programs with relapses in between, multiple periods of prolonged sobriety in between relapses, one up to a year and another up to 18 months. He's had 2 overdoses, one that resulted in life support. He has gotten an infection from a dirty needle that almost resulted in an arm amputation. He has previously participated in 12-step programs and he found them helpful. And he has also been diagnosed with bipolar disorder and depression. His personal life and his family history. He really likes reading, poetry, writing, drawing, and water polo. His family relationships prior to addiction, he was very, very close to his family, his siblings, his mom, dad, stepmother, everyone. And in active addiction, of course, he's got an extremely strained relationship with his parents, but they are still active in his life and active in helping him with his recovery. Prior to addiction, he was the newspaper editor of the water polo team. He was on the water polo team. He had good friends, close relationships with family. Some trauma that may play a part is his parents divorced when he was 4. There was a difficult custody arrangement. He stayed with his father in San Francisco and he had to visit mom in Los Angeles, which is pretty far. And then the other relationships you see in the movie are Lauren, who is a girlfriend, and they go through some pretty turbulent stuff together, and then Spencer is his sponsor from, I believe, Narcotics Anonymous. The model of addiction I'm using is the disease medical model. I think Nick's case suits the chronic relapsing nature of addiction that's described in this model. On the Jelinek curve, I would place him at the chronic phase. He's kind of had that rock bottom moment probably several times. One of them being Lauren's overdose when she almost died. that seemed like it really affected him. And then when his dad refused to let him come home shortly after that, that was a big rock bottom moment for him. And then again, I think at least twice in the movie, but definitely near the end, he nearly died from an overdose. And so those are some of the rock bottom moments that you would see kind of in that Jelinek curve. He's also had multiple relapses, which kind of, shows that the relapsing, recurring nature of this model. He's had at least 6 relapses, I believe, including after long periods of sobriety when there wouldn't necessarily be those huge urges anymore. Um, so it's interesting that you got to see that in there. Um, and then also because bipolar disorder and depression were probably a contributing factor. Um, I think that was kind of an important thing to consider when treating Nick because some of them are behavioral things and things like that, but he has a medical reason that may contribute to it. So, to discuss his co-occurring disorders, he has bipolar disorder and substance use disorder. Bipolar disorder is one of the most common co-occurring diagnoses with substance use disorder. Um, and those two things can cause each other and be a symptom of each other. Um, Bipolar affects impulse control, decision making, and causes extreme mood swings, which may contribute to or worsen addiction. It can also, because of the impulse control, they may choose to take drugs just on a whim or because they just weren't thinking all the way through it, especially while manic. Decision making, same thing. And then, of course, when you're manic, those mood swings, when you're manic, you feel from personal experience, but also from descriptions of it, you can feel kind of invincible and like something can't hurt you. And it's completely reasonable that Nick had periods where he felt like he could take drugs and nothing bad would happen or that he could handle it. And that happens for a lot of addicts as well. They get into recovery and they feel like, okay, now I can control it. And then they kind of fall back into it, which is part of that medical model, I feel like. Yeah, bipolar disorder is known to increase risky behavior, including drug use. Of course, people with bipolar disorder are known to have a higher rate of substance use disorder. And then Nick has stated he uses drugs as a way to sort of self-medicate, which kind of implies that it was to medicate for something else he was experiencing, which may have been symptoms of his bipolar disorder. Significant moments for Nick in this movie were when he stole $8 from his younger brother. Um, that was kind of like one of those first big moments that they show in the movie um, where David's kind of realizing that Nick is falling into an addiction and it's not good. And then, of course, his first overdose, when that happened, he ran away from the hospital. Um, he seemed like he was feeling ashamed or embarrassed, and he didn't want his dad to see him. And that led to a moment between him and his dad where his dad went and found him. Um, and that was a really hard moment for them. He got caught stealing from his dad's house when he was with Lauren. And that's when Karen chases him, and that's a significant moment for both of them, both in the family and for Nick. Lauren's overdose is a big, significant moment. He has kind of a realization that something, like he's in a very bad place and it's affecting other people now. And um, so that's really significant for Nick. And then, of course, that leads up to his dad denying him a chance to come home. Nick calls him and he tells him, you're not going to come home this time. I'm sorry. I really hope you figure it out. And, that was clearly a moment where Nick had a realization about what was happening. And then, of course, he had a second overdose that nearly killed him. And, of course, that's a huge, significant moment because it's another one of those moments where someone with an addiction would go, I need to stop this. And they wouldn't know how. So that's, very significant for him. The theoretical approach, like I said, I'm using the disease medical theory. Because Nick is very bright. Clearly, he was very involved in school. He was a good student before falling into addiction, and he really loves his family. He's very close to them, and he's motivated in his recovery by his relationships with them. That said, the relationships were not enough. So I feel like his issue is not entirely, part of the behavioral model or the social learning, um, especially because he was not around it much. So I don't feel like that was the biggest contributing factor for him. So I also noted that his drug use was not necessarily motivated by trauma, possibly stress because he was, a really good student and his dad did. He does seem to have an issue with his dad, kind of being overbearing with him. So it's possible that it was led by stress, but not necessarily a huge trauma. Um, Nick's drug use is potentially exacerbated by his bipolar disorder, which I discussed earlier, which is part of why I chose the disease and medical model. Also, he's had long periods of recovery after which he relapsed, um, which, kind of shows that relapsing chronic nature of addiction and the fact that he relapsed and it got severe again. So it wasn't like he mildly relapsed, he fully fell back into his addiction, which kind of it illustrates that um, relapsing is a return to illness, that the 12-step programs in this model like to use. Um, and dealing with a lot of guilt, meaning any sort of moral shaming could set him back, anything that kind of tells him that he he's the reason for his own issues. Like, of course, there's accountability that's needed, but um, you know, he seems like he already deals with enough guilt and shame, and he really cares about his family, and he feels like he disappointed them, and that's especially hard for him because he's so close to his family. And so I think focusing on addiction as a disease is the most useful way to treat Nick specifically. And like I mentioned earlier, his motivations for drug use seem to be physical or biological. He likes the way they feel. He became addicted to meth because he felt better than he ever had. And again, he didn't have those other possible reasons, at least not that we've seen from the movie, or from any of my research on him. He is a real person. So, um, but yeah, he mentions that he takes it because it just felt really good. And he has relapses at times just because he's having fun or he's just kind of having a bad day. Not even a terrible day, just kind of a bad one. So yeah, I think disease medical theoretical approach is the best one to use for Nick. Um, the disease model defines substance abuse as chronic relapsing illness, and that requires lifelong treatment to maintain recovery, and defines recovery as total abstinence from all substances. Nick has only been successful in his recoveries during complete abstinence. If he uses a substance, he does fall immediately back into full-on addiction. So I think he's, this model is best for him because his addiction is chronic, relapsing, and only seems to be capable of recovering with total abstinence. Like I mentioned earlier, it defines relapse as return to illness, and because he has repeatedly relapsed, I think for him it's definitely a return to illness and a return to a place where he cannot get out of it without treatment. And also because abstinence and 12-step programs have been most successful for Nick in the past, I think this is a good model for him because those 12-step programs focus on the disease model. And so I think that would work best. So Nick's treatment plan for his individual um, is inpatient rehabilitation program is the level he needs. He needs a full detox because he's frequently shown to have a lot of drugs in his system and is um sorry, he's in denial and things like that. Um for him, he's going to do individualized cognitive behavioral therapy to address the negative feelings he has about life. He's several times throughout the movie made comments about how life just sucks. So, working with him in therapy on that, the feelings about him, his self, his relationships with his family, um, and other distorted thoughts that contributed to his addiction. That's going to be the main counseling focus. With CBT will also include elements of motivational interviewing because he struggles with feelings of self-doubt and self-hatred and guilt, and the experience of multiple relapses, and I think building up his, self-efficacy, and just feeling like he's capable of doing it himself. I think motivational interviewing is important for him. And then, of course, he needs psychopharmacological intervention for his bipolar disorder and depression, and possibly substance use if there's anything available. I don't know enough about that to know, but I would refer him to a psychiatrist for those. Continuing on with his individual treatment plan, I will also do safety and harm reduction information with him because he has had multiple relapses and overdoses, and he did have that former infection from the dirty needle, and he nearly lost an arm for it. So, reiterating harm reduction, I think, is very important with Nick. He will need to discuss some relapse prevention methods because he has had so many. We'll need to look at what has worked and what hasn't worked. I think CBT, relapse prevention, is probably the best way for him. And then, of course, I'll make a safety plan for what to do if Nick is considering using a substance after he is detoxed. Again, because so many relapses, I think having a plan for him, he seems to struggle when he's left on his own. So having a plan that includes contact information for people like his sponsors, parents, his counselor, non-using friends, things that he can do instead of using, things that he enjoys, something to keep his mind off of it. I think a safety plan in Nick's case is an important thing to add into his treatment as well. For his individual treatment goals, I came up with some that may work for him. The overall goal is, of course, to maintain a sobriety by creating a safety plan for when cravings and urges arise, including contacts, like I mentioned, psychiatrist, counselor, safe places to go, things to do instead. And then, of course, he needs to follow his medication regime as prescribed by the psychiatrist to manage his bipolar, to kind of take away that extra element that makes, or at least minimize the extra element that makes it difficult to stop using. Nick will increase his self-efficacy to manage his own addiction and cravings. He feels kind of helpless. It shows, he doesn't understand why he's doing it necessarily, and he feels helpless to kind of do anything about it. And when he does do it, he relapses, and that's discouraging for him. So I think he'll need to learn some coping skills to help manage those triggers, whatever they may be. Fights with his dad, friends that he's around that he uses with. He'll need to learn some coping skills to deal with that. He'll need to return to and regularly attend the 12-step program that he finds most useful, since it has worked for him in the past up to, I believe it was 18 months. That program helped him, so he'll need to return to that. And then he'll, of course, receive information on harm reduction, including clean needle use, needle exchange programs, and safer methods of drug use in the event of a relapse. Because he does prefer IV, I would mention perhaps smoking instead of IV, or snorting instead of IV, which of course have their own issues, but they are still safer than needles, because it does reduce the potential for HIV, AIDS, other bloodborne illnesses. And Nick will increase his self-esteem to help manage his addiction. He'll receive psychoeducation about addiction as a disease, to help him kind of manage that feeling of like moral failing and being a bad person, And then have him participate in family counseling to address that guilt and improve his relationships as well, because that seems to help him. His closeness with his family is really important to him. And so his relationships with his family being good in his recovery will definitely help manage his self-esteem, along with the other things that we're working on. And then to include the family and community in his treatment. We're going to recommend family therapy for Nick, obviously, to help him and his family process the addiction. Um, I'll include Nick's family in his individual treatment as a support network because, again, he loves them. Give them information on harm reduction for Nick so that they can help if he does relapse again and make it feel more manageable for them. And then, of course, make a safety plan for if Nick relapses for both him and them. Because, he has broken into the house and stolen money and he's scared his siblings. And so making a safety plan for if Nick relapses again for the family will be also important, I think. And then AA or NA, one of them, was effective for him in the past, so he'll return to that as part of his community support. What I learned from this movie, from Nick, I learned what addiction is like and some of the reasons why people do it. Um, and I gained a lot of empathy from Nick's story. I think I addiction was one of those things that I did not have as much empathy for as other things. Um, but analyzing Nick's story and kind of seeing his family struggles and seeing why he did what he did and what he went through and the fact that he was really struggling with that, addiction and that it really wasn't him being a bad person. He was a good person with, good family and good friends and who cared a lot and had interesting hobbies and things like that. Just like a whole person. And sometimes people forget that when you're talking about addicts, but Nick was a whole individual, interesting person, and so his story helped me build a lot of empathy, and so that's one thing I learned from him. He's also a great example of what the disease model looks like and who it's meant to treat, I think. As I've discussed it this entire time because of his relapses and his like physiological needs for it, and like the lack of trauma and bad growth, poor family dynamics and difficult childhood. He's absent of those. So there's something else affecting that, be that bipolar disorder or, just something biological, something in his brain chemistry, something like that. I think um, he's an interesting example for disease model. And then he was also taught me some dangers of addiction that I didn't think about before. I know that, like, I'd understood, of course, that, dirty needles are dangerous, but to actually almost have your arm amputated, that was something that never even occurred to me. I thought most of the issue with it was like, oh, you'll get an infection and you'll need to treat it, or you'll pass on HIV. And not that those aren't very dangerous things, but it never occurred to me that you can almost lose limbs, completely blow out your veins, things like that. From David, I learned that caring is not enough to change addiction by itself. And I actually think that's a really important lesson, especially for counselors, because we care a lot about our clients. But addiction, especially, no amount of caring is going to solve it for them. Um, and so, you've got to have a whole community, you have to have a whole village of people helping this person through their addiction. And it needs to include medical support. It needs to include counseling support. All of those things. So I think that was an important lesson for me, just because I, as a counselor, need to understand that I cannot help him alone. But of course, I also learned that familial support can help significantly in the recovery process. Having his family was a big motivator for Nick. And of course, having people care and be there for you when you're recovering is important because it makes you feel like you have a reason to continue to recover. And, you know, um, people that have support just fare better. um, Addiction affects the entire family was, of course, something else I learned from David and the kids and Karen, and his mom. Um, that it affects the entire family. David was really struggling. Karen was a very clear indication. She has a scene that I'll talk about in just a second where you can see that she's very conflicted between her love and her dislike of Nick. Um, but, Nick's addiction became everyone's trauma. And so I think that's that's something that I learned that's really important from David. And then, of course, that the family needs to be included in the treatment of addiction, both individually and together, um, because that was really one of the things that drove Nick's recovery. For Karen, um, she showed me that addiction can create really conflicting feelings for parents. Um, we looked up the scene where she chases after him. I wanted to know why she did that because they didn't explain it very well in the movie. And what it explains is from the book that Karen, or is from one of the books, that Karen was feeling, she thought she was chasing after him because she wanted to go save him from himself, but she stops following him because at a point she realizes that it's a little more it's a little deeper, a little more complex than that because part of her wanted to go save him, but part of her also wanted to make him drive away from the younger children. So it was, a mother wanting to save all of her kids at the same time and then having to choose between one child that she loves and she raised since he was young, um, helping him and then protecting the other ones. And that's a very unique problem that they deal with, that families with a member who's got an addiction have to deal with, is that how do I help my child and also protect the rest of my family? And so I think that was something important that I learned from Karen. This um, this is a song that long before I listened or long before I watched this movie, struck me as important, for addiction and recovery, and I'll let you listen to it on your own time. But the lyrics at the very beginning are, "I've had a hard time adjusting. I had the shiniest wheels, now they're rusting. I didn't know if you'd care if I came back. I have a lot of regrets about that. Pulled the car off the road to the lookout. Could have followed my fears all the way down. And maybe I don't quite know what to say, but I'm here in your doorway. I just want you to know that this is me trying." And, um, oops, stop playing. Um, this is a very long, explanation of why it matters to me, but I felt like the whole thought was important, as, part of my counseling development, as part of my empathy development. Um, I like this song because I think it's a very empathetic look at how people who deal with substance abuse feel inside. Um, knowing that they wake up many days and think, today I'm not going to use, and then fail and, go use anyway, an hour later. Um, I think the song is at some point deep into addiction. They find themselves alone and wanting things to change, but not knowing how. And the song to me is kind of that moment when they decide to go ask for help. And both the hope and the hopelessness that they feel in that moment. You can really hear it in that song. Um, it's that moment of, please still see me underneath all of this. Please see that I'm still good. Please see that I'm still the person you loved before this. This is me coming to you and trusting you to love me when I need it. And this is me trying to do better and hoping you won't give up on me. And I feel like that's got to be something that they struggle with a lot. Um, from the academic perspective, we know a monkey will choose a surrogate to cuddle over a surrogate that feeds it. We know that touch and affection are crucial for an infant's development. We know that children that receive affectionate, warm parenting have the best outcomes in adulthood. My background is early childhood, if you can't tell. We know that, many rock bottom moments are the ones where they've destroyed a relationship or harmed someone else irreparably. For Nick, that's, Lauren's overdose. And it's when he drives away, when he gets caught stealing from his parents and he drives away and they're chasing him. And, um, when his dad tells him, you can't come home, those are those moments where he realizes that he has harmed somebody irreparably. Um, and that's, sometimes some of the things that drove change for him. And I think that all of that's a testament to the idea that there's no stronger need in humans than the need for connection. Um, and so, people with no support system will almost certainly relapse if they try to recover. And again, I know that you can't love someone out of addiction, but love and support and connection are certainly keys once they're ready to recover. Um, and so that's what this song is to me. It's that moment when that need for human connection trumps the need for the substance. And I think that that's where empathy and understanding from other people and for themselves can kind of shine in, even in the hardest cases, even like Nick's, where, he's stealing from family and he's lying and he's hurting people, and, he's gotten to the point where his family won't even let him come home. He still has those moments where he calls his dad and he's like, please help me. I want to come home. I want to be with you. You know, when things are too hard with the addiction, he reaches out to a person. And so that's really what this song is for me, is that moment where you need somebody, and maybe that love can drive you a little bit. And then the personal value of this movie and this experience for me. I've never experienced a loved one through addiction, or experienced it myself. Um, so I don't really know what that looks like or what that feels like. So analyzing Nick's case and his story, kind of, I mean, it was really important for me. Like I said earlier, addiction was one of those things that I did not have as much empathy for as other things. Um, and Nick's story kind of helped me put a face to addiction, kind of humanize it a little more. It's not just those stereotypes that you see in the movies where they're bad people and they come bang on your door and they're begging for money for drugs and things like that you see in movies a lot. It was a whole person who was interesting and smart and loving. Um, and so I think seeing that was really part of the personal value in this experience for me. Just to be reminded that people with addiction are people and like us in every way, and that they need and deserve empathy, and they need and deserve care, even when it's really, really hard. um, Another part of the personal value for me is I was able to kind of relate it to myself in a way, to give myself more of a personal understanding, because I have bipolar disorder myself. And substance use and drinking, that's not one of the symptoms that I deal with. But I do have experience with mania. And I would say that mania, bipolar mania, and substance use disorder have similar experiences, because a lot of the times you come down from that mania and you discover that you've done something so terrible, or just something that you wish you hadn't done, or you really hurt somebody, and in the moment, you didn't care. In the moment, you were doing what felt good, because that's mania. It's all about, that dopamine rush, that adrenaline of buying something or being with somebody, or, doing something that feels impossible. That's my own personal experience. And so I've had to take responsibility for many destructive things that I did during a manic episode. Despite the fact that I had very little control over it. I was not being treated. I was not diagnosed until I was 28, and I had a very severe manic episode that was a year long, because it was from an antidepressant that was just not being well monitored. So, I had a very destructive year. And so, having that kind of helped me understand the disease model, I think, understanding that like you can have this thing you don't even want to do, um, and yet you do it anyway, and you don't know why. And you don't know why, and you don't know why you can't stop. And then when you finally do stop, you have to look at your life and say, what do I do now? How do I fix this who's even going to want to talk to me anymore, you know? And I feel like that's so similar. And it's really hard to understand it if you haven't experienced it, that sometimes you're doing this thing that you have no control over and you don't know why, and you still have to take responsibility and accountability for it because you still hurt people. And those two things are really hard to reconcile to anyone that hasn't done it. And it's hard to do as someone, I mean, it's hard to do. And then to have people understand, you know, to teach someone that they have to take responsibility even though that they don't have control over it, that's hard. And then, you know, to teach people to understand why they that even though they want them to take responsibility and even though they took responsibility that they didn't do it on purpose. Those are really hard things to reconcile for people, you know. And then as a student counselor, what I took from this class is a better understanding of the experience of addiction, obviously, and the causes for it, both biological and environmental. Especially because Nick's was not so much environmental. A lot of it you think is, excuse me, is, you know, someone growing up in a bad home where they grew up around drugs, and Nick didn't grow up around any of that. He had a good, you know, middle class family, decent money. Parents had good jobs. Parents were kind and loving and present and supportive. And so, you know, interesting to just see that sometimes you're just prone to it, or you just like it, or you have something else entirely like bipolar disorder that sends you down a path that makes no sense in you know the behavioral, the environmental aspect of it. Um, and then of course, like I mentioned, and I think I've um, kind of exhibited the greater empathy for those who are dealing with addiction and a much better understanding of how they're feeling and um, like actually almost a love for them because I just feel like I get them a lot more now. And then of course this experience taught me a lot about what's needed to help treat it, both at a personal level and interpersonal level, you know, as a counselor and as a person. Um, so yeah, that's the personal value for me, and I believe that's my whole presentation. So I hope you have a good Christmas and New Year.